In this video, I am going to demonstrate pendulum or Codman exercises for shoulder joint. These exercises will help you to improve shoulder range of motion after surgery in case of frozen shoulder and shoulder impingement syndrome. For this exercise, you have to stand at the edge of bed or table. Then you have to lean your trunk forward and put into flexion. Then hang your arm slowly and move into clockwise direction for the circumduction, clockwise and anti-clockwise direction. Arm will be hanging loosely. You have to move your trunk in rhythmic rocking motion. Then move your trunk and arm into forward direction to improve flexion. Also side to side to improve abduction and adduction of the shoulder girdle. If your patient is having dizziness, low back pain issues, and as well as balance issues, this position will be adopted in prone lying position, and this exercise will be inappropriate if patient is having peripheral edema.